So when you think about the word innate, think about that it is genetically determined. So you're born with it. So it's innate versus being learned. So we sometimes say that this is the most fundamental ancestral type of immunity. Evolutionarily, this what came before the adaptive immunity. So when we think about innate immunity, some organisms only have this type of immunity, and it is super important. So let's look at some components of the innate immunity. So we have barriers. So this includes the skin. The skin is a super important barrier to infection. And if you think about before we had antibiotics and antibiotic creams, for example, if you had a wound or if you were cut and it wasn't healing up, there could be possible big ramifications for that. So the skin is an important mechanism of innate immunity. We also have mucous membranes. So like, for example, in the respiratory tract, when we breathe in things into our nose, there is mucus and cilia that capture debris, and those actually prevent those things from getting into our lungs. Even our trachea has mucus in it that captures debris, and then the mucus is moved up by cilia, which are cytoplasmic extensions of the cells lining the trachea, moved up to the throat and then swallowed. So these mucous membranes are really important for protecting against infection. We also have acid. So when we talk about the stomach, for example, the stomach acid not only helps to break down the protein and connective tissue that might be in your meal, but it also helps to kill anything that you have taken in or ingested with your meal. So that would be a really important mechanism. And so we'll talk about the digestive system, but when you take acid reducers, that decreases the acidity of your stomach, and that might actually make you more prone to getting foodborne illnesses because of that reduced acidity in the body. So we also have chemicals that our body produces. And so lysozyme, these are enzymes that break down bacteria. These are found in our sweat and in our tears and in our saliva. So these enzymes that break down bacteria. Okay, so we also have within our body some cells that have innate immunity. And so many of these cells are what we call phagocytes. And an example of a phagocyte would be a neutrophil and a macrophage. So neutrophils and macrophages can identify and destroy bacteria and other foreign substances that get into our body. So they are important phagocytes. And the way that they are able to do this is they actually take them inside of their cells. So phagocytosis is where a cell ingests something, creates a little vacuole, and then uses enzymes to break down the bacteria or whatever else it's breaking down via intracellular digestion. So phagocytosis is an example of innate immunity. We also have some cells which are called natural killer cells. So if we look at these natural killer cells, or NK cells, so these are NK cells. They actually destroy cells that are infected with a virus. or cancer cells. So both of these types of cells oftentimes have different proteins on their surface. And this difference in the proteins on the surface is what gives the natural killer cells the signal that these are not normal cells. And so they do not specifically focus on a specific type of virus or a specific type of cancer cells. And so this would be an example of innate immunity. Now, a process which is also in this category of innate immunity is what is called inflammation. So inflammation happens when you get injured. It could be external, like when you get a cut. You could also have inflammation internally. And it could also be acute versus chronic. So acute inflammation is something that happens for a reason, like it's a response that is happening because of an immediate injury. But chronic inflammation is something that stays around for a long period of time. And so in general, when we talk about inflammation, we sometimes say inflammation is bad, but actually it is a defense mechanism. And as long as it's not long-term inflammation that gets carried away and can cause other problems in the body, it will resolve itself and it will actually aid in healing. So the signs of inflammation are redness, heat, swelling, and pain. And so if we look at what happens when we are injured, like the surface of the skin becomes injured, we can talk about these stages of inflammation. So what happens when your body is damaged is that the damaged cells release a chemical, and they produce a chemical that signals pain. And it is ultimately going to cause more blood to flow to that area of injury. And it's going to cause, eventually, inflammation will cause the blood vessels to become leaky. And so we have a chemical that you have probably heard of, because in allergies, we take antihistamine. Histamine is a chemical that causes this swelling. And so it causes the blood vessels to be leaky. What then happens is those white blood cells and other substances can move out into the tissue that has been damaged. And so these are neutrophils that are moving out, and they are going to be attracted to microorganisms. And so they're going to go out into the tissue and they're going to hunt down these microorganisms and they're going to eat them. So this is showing the leukocyte or the phagocyte, the neutrophil, eating eating the damaged tissue, but also the microorganisms that have gained entry into your body. So histamine is one of those things that causes inflammation. If you have lots of inflammation in your throat, then that can actually cause problems with breathing. And so that's why antihistamines are important, chemicals, drugs to decrease that production of histamine. So this is just showing the process of inflammation and why tissues swell, why we have increased blood flow. Pain is really important because it gives us the signal that something has happened, something damage to the skin has happened, for example, or damage to an internal organ has happened, and that there is some healing that needs to take place.